Well, still ahead tonight, cancer patients undergoing chemotherapy could potentially keep their hair.
Yeah, coming up, we're going to talk to a breast cancer survivor about what's called the DigniCap and how it helped her. Cancer patients undergoing chemotherapy typically lose their hair. That's because the drugs used to kill the cancer can also take a toll on your hair. Well, DigniCap is aimed at preventing that hair loss. It's a scalp cooling device, which is available to patients at George Washington University Hospital. I'm joined now by Christy Mangier. Is that correct? She is a breast cancer survivor, and Madison Barnes, a clinical specialist, who's going to tell us a little bit about that. First, you wore the DigniCap when you had a diagnosis of cancer. Tell me a little bit about that.
Sure. So I actually used a different system that was a manual scalp cooling therapy. But yes, I did use cold caps to save my hair during chemo. I was actually diagnosed with an aggressive form of breast cancer exactly 2 years ago today. And hearing those words, "you have cancer," is really traumatic. But I was even more devastated by the news that I needed chemo. I was already facing losing my breasts, and losing my hair at the same time was very stressful. And the chemotherapy that I was using also had a small but present risk of permanent hair loss. And at 30 years old, I did not want that to happen.
Well, it's vanity, too. You want to look the best. You're probably worried about your health, but also how you appear. Was that one of your first questions? I'm sure once you talked to the doctor about your diagnosis, were you concerned about your hair? Was that one of the first things you asked about? Am I going to lose my hair?
It wasn't one of the first things, but I think any cancer patient facing a diagnosis, you almost face an identity crisis, and there's so many parts of yourself that change throughout cancer. So I felt really empowered as a patient to have the option to save my hair, because even though it wasn't quite a vanity thing for me, I could look in the mirror and not see cancer every time I looked at myself in the mirror. I am much more than my cancer diagnosis, and I didn't have to project that cancer to the world at every moment.
Tell me a little bit about the cap and how is it new technology? Has it been something that is getting better as the days go on, or has this been something that's been used for a while?
Yeah, so this has been in Europe for several years now. We've been FDA cleared for men and women with solid tumor cancers for a little over 2 years now. And so, everything's constantly changing. So we're always working to make it better, make it available to more women and men.
Do you wear it for just a couple of hours a day? Is it a 10-minute treatment? How long do you have to keep it on your head in order to keep the hair from falling out?
Yeah, so it's during the chemotherapy infusion. Typically, it's 30 minutes prior to the start of the chemo, all during, and then for a period of time of usually a couple hours after.
Mm-hmm. And so as you're getting the solution, you're wearing that, so it's all one time.
Mm-hmm.
And how well does it work? Did you have any hair loss at all?
I did. I probably lost about 50% of my hair, but we have a lot of hair in our head. And while I had a couple of small bald spots and thinning throughout, I still could get creative with how I styled my hair so that you couldn't see those bald spots. And it just made the transition back into normal life easier. Dealing with the after effects of cancer is also very difficult. So it made that transition for me so much easier that my hair already looked normal. I already felt like myself when I looked in the mirror.
Is it cold to wear?
Very cold to wear.
Cool. Okay.
But the great thing about scalp cooling systems like DigniCap is that it's much more comfortable for patients. I used manual therapy, so manual caps that my husband and dad had to change every 30 minutes. That was negative 32 degrees Celsius.
Oh my goodness.
And DigniCap's system is way more comfortable, even a little bit warmer than that, so it makes for a better experience for the patient.
For people watching, is this a technology that is available at most hospitals, cancer treatment locations?
Yeah, so we're working hard to get this into way more locations. We're currently 3 locations locally. Right now we're at George Washington University Hospital, Dr. Fred Smith at Chevy Chase, Maryland, and Chesapeake Oncology.
Well, thank you very much. We're glad to see you're doing so well. And
Yeah.
looking great. Appreciate you guys taking the time.
Yeah, and Cold Capital Fund is also working with cancer centers across D.C. to get the scalp cooling system in more cancer centers and raising financial assistance for
And is there a website for that we can do a shout out? What is it called?
Yes, it's www.coldcapitalfund.org.
All right, ladies, thank you so much for making time for us today.